Hyperpigmentation is a really common skin concern, and it can manifest in many different ways, and all of them are slightly different in their root cause and therefore also in how we need to treat them. So I'm going to talk through today some of the main types of hyperpigmentation and what we can do both at home and in clinic to help address them. So first up is sunspots or age spots or brown spots. You might call them all of these different things. These tend to be discrete little marks, and you will often see them on people's hands as well. They're a really common kind of aging sign on the backs of people's hands. These are usually caused by sun damage. So these are your skin's response to being exposed to too much UVA radiation, and your skin then goes into protect mode and forms these umbrellas of pigment which help to protect your DNA. But obviously the cosmetic effect of that means your DNA may have been a bit more protected than it would have been otherwise, but you have dark spots that are unsightly or bother you. So what can you do about them? First up, I will always start with at-home skincare, because sure, there are ways that you can get rid of these very quickly, but if you don't do something to address the underlying melanocyte function, what's causing them, then you're not going to get long-lasting results. We can go down either prescription or non-prescription routes. There are many great anti-pigmentation ingredients like arbutin, like kojic acid, like licorice or white mulberry, and throw vitamin C into that mix as well. All of these different non-prescription ingredients can help to regulate pigmentation. There are also some more potent ingredients. Now, cysteamine is a non-prescription version which is as effective on the clinical studies as prescription hydroquinone, but without the potential side effects that hydroquinone can carry. So cysteamine is a really good choice for a lot of people, and this is something that you apply to your skin over about 16 weeks as an at-home treatment and can give really lasting results. Hydroquinone can also deliver similar sort of results, but is potentially more irritant for the skin, and on cell studies has at times in higher concentrations been proven to be toxic to the cells. I also like combining almost all of those ingredients with retinol or a retinoid, so this can help to speed up cell turnover and therefore clear the pigmentation more quickly. And an exfoliant like an AHA or a BHA can also help to slough away some of those pigmented dead skin cells on the surface a little bit more quickly. When it comes to in-clinic treatments, if you're looking to blast sunspots, you could consider some laser treatments, you could consider some chemical peeling techniques, and cryotherapy can also be used. So all of these techniques will help to remove sunspots relatively quickly, although it's important to remember it may look slightly darker and slightly worse before it goes completely, but they're all worth considering. Postinflammatory hyperpigmentation is when your skin develops pigmentation in response to inflammation, and a common cause of this is acne. So you might be left with either red or brown marks that take a little while to fade, and they can be red or brown because melanin can be more red or more brown. The colour of the pigment varies depending on the skin type. These can be quite stubborn to treat, and in most cases they will resolve themselves within about 6 months. So say for example you have someone suffering with acne and some post-inflammatory hyperpigmentation, get the acne under control first, and often within about 6 months you'll find most of that post-inflammatory hyperpigmentation has resolved itself. If you want to help it along its way, then you can consider all of the same ingredients as I mentioned for treating sunspots and age spots. All of those ingredients will also work for post-inflammatory hyperpigmentation. And again, treatment-wise, you can consider pretty much the same options as I mentioned, although you might want to also consider combining this with more collagen-stimulating treatments, because if you have acne scarring as well, you might be looking to improve two different concerns with a single treatment. Last but not least, melasma. Now, melasma is quite common and quite complicated. It's more common in women, and it's often associated with hormonal disturbances. So this can be being on the contraceptive pill, it can be pregnancy, and it can be menopause. Melasma presents itself as sort of a symmetrical mask, often in a butterfly pattern along the cheeks, on the forehead, along the top lip, which can appear almost like a mustache, and sometimes on the nose. These are the common areas affected. I see many patients who say, oh well, I wear a sunscreen every single day. If I'm outside, I'm in the shade, I'm wearing a hat, but my melasma still got worse. And that's because melasma isn't just UV activated, it's also heat activated. So you need to think about that really carefully when you're going on holiday, and also if you're considering heat-based treatments. So if we're considering using an energy device on someone who's suffers significantly with melasma will often use some pigment suppression in advance of the treatment. Again, when we're thinking about ingredients, the same rules apply, although melasma can be quite tricky to get on top of, but using pigment combating ingredients, and I will almost always recommend prescription ones in melasma, combined with a retinoid will be the mainstay. But you could consider combining this with some oral tranexamic acid, again on prescription, and there's reasonable evidence that this can help control the vascular aspect of melasma and give better results. Treatments, as I've just said, heat can activate melasma, so I'm a bigger fan of using chemical peels here because we're avoiding that heat component that could help make melasma a little bit worse. It goes without saying that if you suffer with any form of pigmentation, good sunscreen use has to be a staple for you every single day, and not just once in the morning, but remembering to reapply. For many people, dealing with forms of pigmentation can be really difficult and challenging, and things like melasma can involve some big lifestyle decisions. So for example, if hormonal contraception is causing it, at what point does the melasma become too much of a problem for you to tolerate for the benefits that the hormonal contraception can cause? So these can be some pretty big discussions and conversations to have. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.